do have my own genre. So I'm not going to dance, but I am going to give you a PowerPoint presentation, but I am also going to give you something. So my name is Jacqui and I work as a consultant for the Lyme Disease Association. And today I'm going to talk to you about what's happening for the Australians who've been bitten by a tick, have become ill, and find themselves in what we call our medical abandonment situation within a very health system that's intended to protect them. But before I start, I'd really like to know who from the audience, just a show of hands, who's heard of Lyme disease? Everybody? Who's also heard it doesn't exist here in Australia? Almost everybody. Okay. So if I might ask you, I'm going to pass these around. There's a little green hearts. Please take one. We'll come to this. Thank you. So I'm going to talk with you today about a high-level overview of what's actually happening here, so that you can understand what the challenges are, and then I'm going to give you some insights into what life is for a handful of patients, and then hopefully with a better understanding of the patient situation, you'll be able to walk out of this room today and help us to bridge the gap between what the medical establishment thinks is happening and what the reality is for people with Lyme disease. So when I found myself a recruit to Lyme World, the first questions I asked revolved around what the scope of the problem was. I was really shocked to find that there was no answers. People have been turning up for eons in emergency rooms with acute tick paralysis, associated complications, meat allergies, and this has been going on for years. There was no official data on this number of people suffering. There's no epidemiological study, there's no surveillance, and really there's no answers. However, there are 525 cases reported in medical scientific literature in Australia, but all of those case reports are dismissed because of the unreliability of the diagnostic method used by the researchers. So the LDAA, Patient Support Organisation, we represent the thousands of people that are suffering from Lyme disease. We started surveying and collecting information from our patients who identify with a Lyme-like illness, and we've been doing this for 6 years now. We have a statistical map, and we use a dot plot, and we use the rural and remote classifications. And since we started spatial tracking, more than 2,500 people have reported to us that they have a medically diagnosed case of Lyme disease. That means they've seen a qualified medical professional who's ordered diagnostic tests to confirm and have confirmed clinically and diagnostically that they have a case of Lyme disease. 2,500 people have reported to us. They're the people that are online that we can reach. They're not all those people in the community. And what our information tells us is that Lyme disease is non-discriminatory. It affects anybody in any location. 33% of our patients live in regional, rural and remote areas. Those are the ones that are highlighted by the darker shading and the light shading. That is the regional, rural, remote classifications on our map. We also plot where people tell us they were bitten by a tick, and that's the data that you're looking at here. So each one of those small ticks on that map represent where someone who's been diagnosed with a case of Lyme disease report they were bitten by a tick. So if you think it's not in your backyard, it's not a lot in the middle of the country, but it's just about, in every big coastal regional town, and certainly if you go on holidays to the beach, you may encounter a tick. So we think this is the tip of the iceberg. We think that there are likely many more people with a Lyme disease in Australia than we actually know. In all other countries, Lyme disease is on the rise. This is a global incidence map of Lyme disease. We track prevalence across 39 countries and can report a 5.8% prevalence rate across the countries that we track. In this chart, you can see that the database for infectious diseases, has Australia as endemic area. A few years ago, the US updated surveillance figures by 900%. They now estimate more than 400,000 cases of Lyme disease per year. If we used a similar rate, if we used a similar incidence rate to what they have in America, we estimate that there's around 20,000 people per year becoming ill after tick bite. To put this in perspective for you, the incidence we estimate is more cases than breast cancer and 20 times more cases than HIV, AIDS and multiple sclerosis put together. Do I need to repeat that? 20 times more cases than HIV, AIDS and multiple sclerosis put together. So, There are many, many complex challenges that contribute to this problem in Australia, and since we don't have a whole day to talk about them, I've only got 14 minutes left. I can't talk about all of them, but I'm going to talk about a critical few. So we heard when I started, the people in the room that said they've heard the rhetoric that there is no Lyme disease in Australia. This position is predicated on the notion that we've not found the causative agent, Borrelia burgdorferi. However, the presence of Borrelias in Australia was established in 1959 in animals, in cattle, and human cases of Lyme disease have been reported since the 1980s. Our authorities ignore this evidence on the basis of a single study, highlighted in red, that happened in 1994, that reported they couldn't find a Borrelia. They dismissed spirochete-like objects, which is what a Borrelia looks like, as artefacts. So, what that means is we've had a 20-year research gap. No investment into research on Lyme disease or its causative agent had happened for 22 years. In that time, there's been 7 new Borrelia genus species discovered internationally. And in 2016, Murdoch University in Perth broke the research drought here, and they actually conducted the first study into Australian ticks in 22 years. Not surprisingly, their study found several novel pathogens we'd never heard of before, and an indigenous species of Borrelia, which has long been hypothesised to be the case here in Australia. They've since sequenced that Borrelia, and they've called it Borrelia tachyglossae after the echidna from which the tick was found. So the Murdoch research study actually shows that Australian ticks are full of pathogens, many that are known to cause diseases in other parts of the world, yet we have no understanding as to whether these pathogens are affecting Australians after tick bite, because we haven't prioritised adequate research funding to actually investigate the issue. The second major challenge for us is diagnostic failure. So internationally, the recommended serology test for Lyme disease, it's a blood test, failed to detect it in 50% of the tests. We use these recommended tests in Australia, and our authorities have adopted a 2-tier testing protocol, which was devised for surveillance in the US, and we've adopted it for diagnosis in Australia. The criteria used to determine this positive test has not been defined, and it's not consistently used across the laboratories that are doing this test in Australia. So I simplify that for you. The test is known to fail half the time we use them here. We Medicare fund them. We add inappropriate diagnostic protocols, one intended for surveillance, not diagnosis, and we have obscure and inconsistent, almost secret, ways of determining the positive result. On top of these issues, some Australian laboratories appear to have their own rules for determining whether a patient has Lyme disease. So this is a patient's laboratory report from an Australian laboratory. It shows they're not using the prescribed 2-tier test, but a 3-tier test. You have to have a 3-tier test in this lab. So the patient must have and pay for 3 different types of tests, all confirming a positive result to receive a pathology-confirmed case of Lyme disease. No other country uses this protocol, only us. This patient, ELISA IgM detected, Western blot IgM detected. That's 2 tiers of detection. On the basis of the 3rd test, this patient was told they have a false positive test and don't have Lyme disease. I could show you hundreds of these tests. Not surprisingly, patients then send their blood overseas for testing at specialist laboratories, normally at significant expense, about $1,000 it costs to send your blood overseas to be tested. And then we have an issue in that the responsible authority for pathology testing in Australia actually uses an evidence-based argument to suggest that overseas tests actually aren't validated. So the patients who've they can't get a valid test in Australia, they're put through 3 levels of hoops, they send their blood overseas at considerable effort and expense because it has to be at an airport and on a FedEx plane, it's a big palaver, and then their tests that they get from overseas are routinely denied. So, the issue of Lyme diagnostics is a problem everywhere, not just in Australia. And if you were to ask the clinicians who are currently treating patients about the standard diagnostic test, they'll tell you that the tests routinely fail patients in Australia and their clinical data supports them. The other issue impeding the diagnosis is an undereducated medical community. They're reliant on official information that's inadequate. Practitioners and clinicians, they're telling you they are constrained. They also need better support in contemporary and translational research, unambiguous guidelines that keep pace with the emerging global and domestic research, and they're not getting it either. Then there is the issue of stigma. The word Lyme just carries a construct and a dogma of stigma and controversy, which is further exacerbated by the Department of Health, who labels the illness as DESCAT, debilitating symptom complexes attributed to tick bites. Could you think of anything more obscure? So this affects patients in negative ways. Most of the stigma evolves from ignorance, and it's detrimental to patients because it carries with it the implication that there's something discreditable about the patient. So Lyme disease is a controversial, politicised and underestimated disease everywhere, not just in Australia, because of how it's been framed wrongly by American medicine. They frame it hard to get, easy to diagnose and simple to treat, which is far from the truth. So we've been researching our patients for 6 years now, and we can provide lots of information on what the patient experience is. We do web-based reporting, we do qualitative research, and we're hearing patient stories every day because they come to us in desperation. We've categorised patients into 4 or 5 areas. The first are those that have got an illness after following tick bite, and it's acute. They get a tick, they get the typical bullseye rash, some do, some don't, some remember a tick, some don't, and then depending on the severity of their symptoms, they may or may not go to the doctor. Most don't. Then we get others that might remember a tick, may go to the doctor, told, oh, you don't have Lyme disease in Australia, don't treat it, off you go. Then we have people who are suffering from long-term illness, those people that find themselves in wheelchairs, they rely on others for their help. And then there are people with long-term illness who've been misdiagnosed. They're people who've been told that they've got multiple sclerosis, MND, ALS, Alzheimer's, all these other neurodegenerative diseases. These patients are depressed and they're losing hope. And there are children of parents born to parents with Lyme disease. These children have contracted the illness before they're even born, and they have lots of difficulties. So who took a heart? Did you all get a heart? Mm-hmm. Okay, those hearts, those green hearts were made for you by a child with Lyme disease. Our research also tells us it takes 10 years at a minimum of 13 different doctors to receive a diagnosis. Can you imagine? 10 years, 13, minimum of 13. Some people report 30, not 13, but 30. So, and even finding a doctor who will treat them is almost insurmountable in Australia. Because of this, 10% of our patients go overseas for treatment. Each pin on this image indicates the hometown of each Australian who was treated at a single clinic in Germany. And those treatments in Germany cost $60,000. Those that can't afford overseas treatments, they're left to travel. Some of them travel distances of more than 500 kilometres to an urban practitioner, 500 kilometres there, 500 kilometres back, to an urban practitioner to get treatment. And for the 33% of Australians that actually live in regional, rural or remote areas, you can start to understand the compounding burden of their illness impedes any chance that they ever had of recovery. We also examine the burden of illness on patients. We know that 64% of them have had to quit their job, school, study, and that 65% spend entire savings on healthcare. We have patients who are managing their own PICC lines, portacaths, IV, antibiotics and stuff in their own home without even the most basic educations about hygiene. It's appalling. Our analysis of patient submissions to the recent Senate inquiry that they did on Lyme disease found that the average out-of-pocket medical cost was $42,000 for Lyme patients. We compared that with the report from the Institute of Health and Welfare that says the average Australian pays $142 with Medicare services, or if they have a health-related chronic illness, $1,100. Our patients pay a minimum of $45,000. You can read the 600 submissions made to the Senate to see this data for yourself. Sadly, Those submissions to the Senate inquiry recount appalling stories of the discrimination and the disrespectful treatment that our patients suffer within the medical system that we all belong to. Sadly, there are also many patients that when they're faced with these insurmountable odds, don't ever think that they're going to be well again, and they determine to take their own lives. 7 Lyme disease patients in our community have determined to take their own lives in the last 5 years alone. These are shameful statistics. These are people who realise that they need help and they seek it, but for whom there's no help at all. I want to make a special mention of the medical abandonment of our children. Most Lyme disease surveys tell us that children are significantly underrepresented. We know that there's 87 people in Australia who we know about, we've been tracking for a few years, who have taken time off school and are living a life that's suffering with Lyme disease. It's a despicable situation and it does nothing to help these children. I'm going to introduce you now in the last few minutes that I've got left to talk to you about a few of our patients. These are real patients who were once normal people with once normal lives. This is Renee. He became ill in 2016. He was caring for his wife. She also has Lyme disease. He was diagnosed with ALS, but because his symptoms were very similar to his wife asked for him to be tested for Lyme disease. He sent his tests overseas and his results came back as positive to Lyme disease, mycoplasma pneumonia, a whole host of viruses. Basically, his body was a powerhouse of bugs. He was placed into palliative care because his medical team wouldn't consider Lyme as a diagnosis. Renee passed away on the 5th of March. From the time I wrote the paper for this conference to the time of sharing his story with you, he died. This is Natalie. She was a national parks worker on the mid-north coast, so one of those great rangers who go around and make sure that there's wood in the barbecues and there's clean toilets for us and stuff like that when we go camping. She was exposed to hundreds and hundreds of tick bites over the years. She took more than 10 years to get a diagnosis, which meant that she's extremely debilitated. She's received overseas treatment many times and she improves considerably when she's overseas. But when she returns home, she can't access the treatment in Australia and she's slowly deteriorating. She's lost her relationship, she's lost the full-time care of her daughter, and she's lost her dignity. This is Mandy. She's 31 years old, and she lives in an aged care facility. She's been sick for half of her life. She acquired Lyme disease when she was in her teenage years. She's had multiple positive tests from overseas. She's had multiple positive tests from Australia, even, if you can believe it. She suffers seizures, paralysis, a whole host of despicable things. She's socially isolated from her own peer group. She describes her situation as hopeless. And this final person that I'm going to talk to you about is Rebecca, also a young woman who should be in the prime of her life. She was bitten by a tick when she was on holiday in Western Australia in Kalbarri in a national park. Within 24 hours of that tick bite, she was in hospital. So we have an acute case who entered the system, who could have been helped. Fast forward a few short years and her life is a living hell. She can't care for her children anymore. She's lost her children. She's lost her relationship. She felt her situation was so hopeless that she tried to take her own life a year ago. And now she lives committed in a mental health facility. This is what's happening for patients in Australia. I've told you 4 stories. I could stand here all day and tell you story after story. So, I'm sorry, this is Rebecca today. No. Shall I go back? It's confronting, isn't it? So, I've got 1 minute. This is what I want you to do. We're calling upon all delegates today to join us in recommending that there's immediate patient-first focused action in this area. We want to have a national awareness and prevention campaign. Lyme disease is 100% preventable with protective measures. If we're taught to look after ourselves, spray ourselves with deep, use oils, dress appropriately for the bush, tick check when we come out of the bush, we can avoid even entering this funnel. So a national awareness and prevention campaign would help stem the flow of patients into this system. A comprehensive support package for patients, those patients today that are suffering, that are stuck within these mindless systems with no one advocating for them, would ease the burden of their illness. A medical education for doctors, on tick-borne disease would underpin a new era of knowledge and help minimise the stigma. We put in a funding package in our pre-budget submission for better patient-focused research, and we demand a coordinated national action plan. There are ticks all over the country, we saw them. So I thank you for having the courage to come today and learn about the situation for Australians. We started the conversation, you hold the heart of a child in your hand. Please help us. Thank you.